Okay, it's trying right now. All right, I think we are live.
All right.
Thanks everyone for being patient with us today. As you can tell, we're testing out some new technology. I'm sure a lot of you between school and work are using Zoom, and so we're trying that as well today. So thanks for joining us. We have Dr. Ashley Millham, casting in, I think might be the term, I'm not sure. And then I'm Ashton Day, health educator here, and we have Shelby interpreting. And then I am going to be watching for questions on my phone on the Facebook Live. So if you have any of those, feel free to send them our way. But first, I think we're just going to start and kind of recap this week. It's been a little crazy with the stay-at-home order, but I think a lot of people either want to know or they're not sure why the stay-at-home order is so important for our community right now.
Sure. So that is, I think, a question on just about everybody's minds here in mid-Missouri, or at least in Boone County, I guess I can only speak to. So we are all talking a lot about social distancing, and this is just the next step in social distancing. So we still want those same principles of keeping 6 feet apart, because we still know that the way this particular virus is spread, of course, speaking to the virus that causes the illness COVID-19 is what we're referring to here today. So based on how that is spread, we know the best ways to protect ourselves are still to keep at least 6 feet distance apart, covering any coughs, sneezes, really good hand washing, and then limiting our exposure completely with other people as much as we can to prevent the spread. And just given how contagious this is and how many cases are present around the world, in our country, and in our community, that's where this is designed to help really try to prevent the spread of this particular virus, to keep everyone as healthy as possible, and really protect those more vulnerable populations as well that can have the potential to get really seriously ill from it.
Right. And I know you were doing a lot helping coordinate with providers in the area and kind of navigate this whole situation. What have you all been learning this week?
Yeah, so that's so much. There's so much information to learn. And so I think, everyone in the healthcare community in mid-Missouri is really trying to work together to make sure that we all have the best information possible and how to get that information to our patients as quickly and having as possible, and having it as readily available for all of you as well, and really having the same information, make sure we're all having as accurate of information as possible. And so it's been a lot of communicating to make sure that all of the providers who are going to be speaking with their patients have the most up-to-date information. And so that is including not only kind of what we should be doing to protect ourselves if we have those additional illnesses like diabetes or heart disease or lung disease, or even being over the age of 60 or 65, having those conditions and wanting to stay more protected. So having us all on the same page as far as this is what the best data is showing us right now. And that's really to limit your exposures, limit your contacts. We know that the virus is most contagious when someone has symptoms, but the CDC also states very clearly that there is a chance for transmission, that they suspect some of the transmission happens prior to symptom onset. Even though that's a small number, it's still something. And so limiting the exposure as much as we can altogether, that is how you would really eliminate that risk as much as possible, knowing that you don't have to have symptoms.
Right. That makes sense. And I know a lot of, cases kind of became, what am I trying to say here? There were a lot of new cases being reported at the state level and the county level this week. Why would that be?
Yeah, so it's not just about the spread of the virus, but also the increased availability of testing really helps us identify who has it as well. And so those numbers do show that this is a contagious virus still, as we expected them to, but it also speaks to the amount of testing that's able to be done. So we're obviously really fortunate to have both university and Boone hospitals with the drive-through testing sites, and they've done a lot of things to make those tests more accessible, not just through their drive-through testing sites, but waiving fees either for the test or for the visit to get the order for the test. I'm really trying to make it more accessible to people who need that, whether it's because they are going to be around someone who has risk factors, whether they're going to be working in a healthcare facility or a different congregate setting, or whether it's someone who is older or has one of those underlying conditions that puts them at higher risk. And so they're really trying to make that testing available. And so that also kind of contributes to that rise in numbers.
Yeah, and we have a question here in our comments. How would someone without a primary care physician get tested?
Okay, yeah, that's, thank you for asking that. So there are video visits that you can do for free if it's in regard to COVID-19 through the university. It's the MU Video Visits app or website. And then Boone is doing, and that's a free visit. I don't know if I said that at the beginning, and you don't need to have a primary care provider to do that. You would be seeing a virtual provider. I mean, it's a real provider, but on the other end of your computer or your phone. And then Boone has, their testing is free, but you have to have an order still. And so to get that order on the Boone side of things, you could, call primary care clinics and see if they were able to see you, even if you're not an established patient there, or there are urgent cares as well. And some people's insurance companies also offer virtual visits. I think the tricky thing probably for that would be getting the order in hand if it's not a provider that's plugged in here in mid-Missouri the way someone who's either physically located here or is a virtual visit set up through one of the institutions doing the testing.
Yeah. And I believe the university this week decided that they would no longer require people to get tested. They would no longer require you to have traveled to get tested. Is Boone's requirements different too?
Yes. And so the guidelines altogether have been really updated from the state level on Monday. They came out with new criteria for their lab, but they also came out with a slightly different guidance as well. So, the state comes out with specific criteria that a person must meet to have their test run at the state lab. And their aim with that is to make sure that they have enough testing supplies there. If there was a lot of testing to suddenly go on, they want to make sure that they still don't run out of supplies for people who are critically ill or who need that testing the absolute most. And then they also, though, provide guidance separate from that criteria for providers in the state based on where we're at with the situation. So based on how many numbers we're seeing and who's getting sick and where these people are contracting the infections from. So based on all that data for our region or for our state, they come out with criteria for who should be given consideration for testing. And so they updated both of those pieces on Monday. And so that's, I think, what the institutions, are also upgrading theirs or shouldn't say upgrading, updating their guidance at the same time, really in parallel with the state. And really the focus is still people with symptoms are the ones who should get testing. And still, if you have mild symptoms and you don't have underlying risk factors and you're not going to be working in a healthcare setting or working with a vulnerable population, then you may not need testing. It's not that you don't have the illness. If you suspect you have the illness, but your symptoms are very mild and you don't have those other risk factors or the other chances of exposing someone else at risk, then staying home for the recommended amount of time, which would be at least 7 days from symptom onset and at least 3 days from what we call symptom recovery. So fever-free for 3 days and having improved respiratory symptoms for 3 days.
Yeah. And as more people get tested and we have a few more positives in the area, a couple employees that that in your workplace might have tested positive, like what should people do if that happens to them?
Sure. So it kind of depends. I think we maybe talked just briefly about this last week, but your exposure to someone, if it was weeks before they had the illness, that would not really be an exposure. If it were when they were having symptoms and they were diagnosed and those symptoms were due to COVID-19 and you had close contact with them, then that would certainly be considered an exposure. And if you had, if you were exposed just right before they developed symptoms, then you'd also want to keep that in mind, even if it was prior to symptoms, in which case you may not be considered an actual contact from the CDC's definition of that, but you would still want to keep that in mind. And so kind of how you handle that if you were exposed to someone who, and exposed being in close proximity, less than 6 feet for a prolonged period of time, or having direct contact, if that's the situation you're in, then you really want to not take a chance on exposing anyone else for 14 days. So it can take up to 14 days for symptoms to show up. So we call that quarantining, when you don't have symptoms, but you could potentially have been exposed and therefore could develop the infection. Then for 2 weeks after that last exposure, you would really want to not come into contact with other people. And then if you developed symptoms during that time, you would want to talk to your provider, do one of many ways to talk to a provider, whether it's your provider or an urgent care. Just call ahead and make sure that they know that you had an exposure and what your symptoms are, or again, doing a video visit. Fever, cough, shortness of breath, sore throat are the primary symptoms. Certainly they're not the only symptoms, but they are still the primary symptoms that people have. So if you're experiencing some of those symptoms and you've had a known exposure to this illness, then it is worthwhile to talk to a provider. And if those symptoms are severe, where you're having difficulty breathing or significant chest pain with it, then getting seen emergently is still the right thing to do. But you do want to call ahead or let them know before you go in, so that they can provide you with a mask and help limit the transmission of the potential infection.
Yeah. And then I think we talked a little bit about this last week as people were kind of starting to go on spring break, but now we're at the time a lot of people could be coming back. What should people consider if they're going to be coming back to town?
Sure. So you want to probably keep an eye on what's going on in the community where you had traveled. If you are considering travel, I would strongly recommend that you reconsider that, both for yourself and your close family and friends, but also for the communities, taking infections kind of, potentially bringing those infections one direction or the other. And so, but if it is essential travel, or if you've already traveled and that's been done already, then keeping an eye on where you had traveled from, kind of what's going on in that community, as well as just recognizing if you've come into contact with a lot of people, you may not know about all of your exposures. And so hopefully you've been practicing social distancing and that's not an issue. But if you've come into contact with a lot of people, you ought to keep that in mind. And if you develop fever, cough, shortness of breath, sore throat, with any severity at all, then you need to be speaking with a provider. If you have those symptoms and they are very mild, then I would encourage you to isolate yourself. Again, you would be isolating, until 3 days of symptom recovery or of illness recovery, which would be 3 days without a fever, 3 days since your respiratory symptoms, those other symptoms improved, and at least 7 days since symptom onset, to make sure that you're not going to be spreading that.
Right. So I know, it is becoming allergy season. I myself suffer from allergies every year, but it can have a lot of people concerned, especially right now with the whole COVID outbreak going on. So how should somebody recognize if their allergy symptoms are more so COVID symptoms?
Yeah, that is a question that a lot of people have been asking, I think, even through Facebook and of their providers, I think, too. And so it's an important thing to think about is, what are your typical symptoms for you? And that's a little bit different for different people, whether you have allergies or asthma. If your symptoms have been really consistent and these are your typical symptoms and they're mild and you don't feel acutely ill, meaning you don't feel like you've suddenly developed another infection, you otherwise don't feel unwell besides what's typical for you, then it's probably more your allergies or your asthma. However, if you feel like these are the worst allergies, or this is like an asthma attack for me, then that would be concerning. And so the symptoms can be similar. There's overlap in what the symptoms can look like, but it's a different time course. And so again, if you've had weeks of mild symptoms and they haven't changed, that would be less likely to be due to a COVID-19 illness versus if you had symptoms that were very unique for what you typically experience with your allergies. And asthma is certainly something I'd say kind of more significance as well in the setting of whether you have COVID-19 or not, that has the potential to be a more serious illness. And so if you have uncontrolled asthma symptoms, whether or not you think you've got COVID-19, you should be talking with your provider, especially with the current pandemic. That would be a smart thing to do.
Yeah. Under the stay-at-home order, essential businesses and employees of essential businesses are still going to work because they are valuable to our infrastructure. But what are some things they can be doing at work to make sure that they are staying safe?
Yeah, so it's absolutely that practicing social distancing. So keeping that 6 feet, just like I think everyone can see there at the health department, all for those meetings, everyone is staying 6 feet apart. You can't totally appreciate the 6 feet between our wonderful interpreter and Ashton because of kind of the depth. You don't totally grasp the depth perception there, but they are 6 feet apart as well. And so just practicing kind of what we preach there, the 6 feet is really, we use it enough that is sometimes it may not seem like it's really that important, but it is. The reason we keep saying it is for a reason. So keeping that 6 feet distance, really good hand washing, avoid touching your face. If you catch yourself touching your face, wash your hands immediately. And I do think, there are ways to maintain a social connection without being within 6 feet of someone. And so, you can still have friendly dialogue and you can still have a smile on your face and have conversations. And it's just doing it in what we, typically it feels like a kind of awkward, but that's just kind of got to be how we approach our interpersonal interactions, right now to protect each other.
Yeah. We have a question from someone. Since you've been working with these providers, you all have created kind of a protocol system. Do you think that these protocols will be taken into consideration for future sickness and stricter sanitation rules and that type of thing? Is there a plan being developed for the future?
Yeah, so there may be. I think right now our focus is really on the here and now, but I think a lot of the principles could be used for other viruses. Part of the protocols are really specific to the COVID-19 illness. So the 7 days from symptom onset, the 14 days if you were exposed but not having symptoms, the 3 days after illness recovery, those things are really specific for this particular virus, this particular illness. So I don't think you're going to be able to extrapolate that to other illnesses necessarily. I think that, whenever it's flu season, maybe in the future, we'll think about kind of keeping our distance and extra diligent hand washing. And so I think parts of the recommendations can be used for other illnesses in the future. And some of them are really specific for this particular illness. And as far as the disinfecting goes, I think, the overall recommendations are going to be very similar, but there are specific products being listed that we know would kill this particular virus. And that may not be exactly the same for all other viruses. So that might be one piece of the disinfection kind of recommendations that would be specific for this scenario and can't be extrapolated, but some of them, absolutely, a lot of the general principles could absolutely be used to combat other illnesses.
Yeah. We have another question. What is the difference in the Boone County COVID-19 community spread versus other areas? I'm not sure I totally understand the question. So I'll speak to the best of my ability. And the person can, I would welcome a follow-up question if I don't speak to your question as you're intending it. But I'd say we haven't identified a whole lot of cases of community spread yet. We have identified some that we suspect are community spread, meaning we can't trace that to a specific source of either travel or one particular contact that person contracted the illness from. And then we've got some newer cases that I don't think that has been determined yet. And so from a sheer volume standpoint, it really depends on the community. So in Boone County specifically, we are not seeing what we would call a significant amount of community transmission. We are seeing some, and that
goes into consideration with all of the new recommendations and the new orders that have come out, but it's not a significant amount of community spread that can change at any time. I feel like I should maybe say it's 12:37 on Friday, because that might be a different answer tomorrow, and I'm not trying to have a magic ball here. I don't know if it will be different or not, but I can only speak to what's going on right now. So kind of to contrast that with other communities, there are some communities that are seeing no cases of community transmission, and there are some communities that are seeing a lot of community transmission. And so I would say we're different in our prevalence of that right now. And again, that has the potential to change at any point.
Yeah. I'm sorry, I'm trying to check and see if there are any other questions. Has there been anything that we haven't talked about yet that you feel is important for the community to know right now?
So I didn't even run this by you, Ashton, so I'm hoping this is okay. Can I share my screen and show a couple of graphs?
Yes, I believe
okay.
I have permission to do that on mine.
Like it'll let me. I wanted your permission though.
No, I just want to make sure it. Oh. I'm not seeing yours. Did I lose her? I might have. I think we might have lost our connection with her. We'll give her 1 second. And in the meantime, if you want to keep asking questions in the comments, if the live doesn't work right now, we will be sure to answer them back for you today. See if I can re-invite her here.
I'm so sorry. I should not have tried that.
It's okay. So maybe popped up for a second.
It did pop up for a second.
Yeah, and then we lost you, I think.
So maybe we can share it on our media source. So I had found a couple of charts. We've talked so much about social distancing and how that flattens the curve, and I think a lot of people have seen those graphs, but maybe not everybody. And I think that visual representation of it really can help it make sense as far as why this is a good idea for our community and why it can help save lives. I mean, that's ultimately what's happening. That's the whole point of flattening the curve is to save people, is to save lives. That we know that there'll be less life lost if we can flatten that curve and be able to keep up with taking care of the patients who get seriously ill from this illness. And so maybe we can share those later.
Yes, we will definitely do that. And I think you make a great point. I mean, it really shows the importance of sticking together as a community, but doing it by staying apart right now. And that's the best way to make this, go by faster.
Absolutely. And getting creative with staying connected remotely. So clearly I am still working on my technical skills with things like Zoom, but there's a ton of great types of technology that can help you stay connected. And so really utilizing those, and, designate somebody in your family or in your kind of friend group to be in charge of inviting. So like Ashton would be that for us, and it would not be me in charge of that. And so, doing that within your group. So really though, to stay connected and because this is a really hard thing that we're asking of people. It's important, but it's still really incredibly hard, and I understand that. And so also I really want to kind of reach out to for that Get Help and Give Help, those links on our website. If you are struggling in any way, there's a ton of resources, whether it's for mental health services or for other kind of types of basic needs. That can be a really important resource. And I think whenever we're requesting social distancing, we're requesting somewhat of isolation from people, then I just want to make sure people are able to get their needs addressed. And I think you all have done a wonderful job of making those accessible through the website. And so if you aren't already aware of that, or you haven't already looked into that and you feel like you could benefit from something there, please go to that site.
Yeah, and that site is como.gov/coronavirus. And then we did get a clarification on that question I asked you earlier.
Yeah,
so she was more so asking, what's the difference in the unknown versus the community spread numbers that are listed on that website? So maybe talk a little bit about how we do our investigations and how we come to those conclusions.
Sure. So she's kind of, he or she, sorry, is wondering if unknown origin is the same as community transmission.
And like, what's the difference really?
Okay, so they're the same. So if there's unknown origin of that, so that's a good point. So I'll kind of explain it up front, and then I'll explain our contact tracing process so that you can kind of see how we get to that decision. And so unknown origin means that we can't identify a hotspot, so to speak, that they traveled where they would have likely contracted it, or a specific person that they encountered who had the illness where they could have contracted there. So that's unknown origin. And it is, for our purposes in this discussion, is the same. They're synonymous with community transmission. And so because community transmission means the same thing, it means we assume that has come from somewhere in the community because the person hasn't traveled to a place where we suspect they would have gotten it, and they haven't come into contact with someone that we know had it. So how do we arrive at that? So whenever someone has a positive test or has, we say, a confirmed case, so known COVID-19 illness, then we speak to that person and we figure out who have they come into contact with since their symptoms started. And then we reach out to each of those. And when I say come into contact, I mean what we call a close contact. So that means less than 6 feet for a prolonged period of time, or direct contact, like with where you could have come into contact with secretions of some sort. And so then we reach out to each of those close contacts, each of those potential exposures for that person, to let them know that they potentially have been exposed, and we request that they quarantine. That's the guidance at this point in time from the CDC. And I think we talked about that earlier, but if that's not clear, somebody can ask that question. I can explain what that means more in depth. But and then we monitor those people for symptoms. And so that if they were to develop symptoms, then we're kind of tracing where that infection came from, and then just also identifying the infection for those people really early on.
Yeah. And I think that really speaks to the importance of, even if you work at an essential job or you still need to be out and about, if you have symptoms of COVID-19, stay home. Even if you haven't been able to get tested yet, you really don't want to risk spreading it to a loved one or anyone, really. Okay. Not seeing any other questions at this time. And we are about at our usual ending time. So I think, you spoke to it already, but I really think we should end on what the role with personal and social responsibility is for flattening the curve and how important that is.
Yeah, I agree. Our goal is to keep our community as healthy as possible. That is saying it on a broad level. On a more personal level, that means trying to save as many lives as we can from a prevention standpoint. That is the whole point of flattening that curve. The definition of that is helping prevent a sudden spike in number of cases that would overwhelm our healthcare system. We know that social distancing from prior pandemics and from other places during this pandemic, we know that social distancing strategies are the best way to do that. And social distancing is an umbrella term. There's a lot of pieces within that, including staying 6 feet apart, not coming into direct contact with someone's secretions, which ideally not coming into direct contact with them. If you are sick, isolating until you are not sick and until you meet that criteria that we talked about earlier. If you have been exposed, quarantining yourself, meaning essentially not trying not to come into contact with other people for 14 days from your last exposure. Those are all parts of this social distancing, specifically to prevent a sudden spike in cases that would overwhelm the healthcare system and make it to where not everyone could get the best care possible. That is not what's happening right now. And we want to keep it that way. We want to make sure that our healthcare system is able to treat any of you that needs their treatment. We want that to be available to you. And so that is, we are all playing a role and we will all benefit from it.
That's such good points to make. And I'm so glad you were here today to join us virtually. And I encourage everyone to check out any sort of virtual technology and, just have these moments with family or friends. And it's a great way to connect. So thank you for joining us today, Dr. Millham, and thank you.
Thank you all.
We will be ending this today, but we will be back next week with more information for you. So feel free to keep sending us those questions you might have about COVID-19. All right, thank you.